Hey there, welcome to another episode of Scrubs in Software. Dr. Durrani here, and I wanted to share OpenEvidence. OpenEvidence is like ChatGPT but built for clinicians and folks in the medical world. It's an AI-powered search engine. It's a large language model, but it's not trained on everything on the internet. It's trained on medical-related items, PubMed, clinical trials, meta-analyses, and it sources all of its recommendations. Here right now you can see what it looks like. The main thing that I love about it is when you do ask it a question, it sources everything. You can then click on those papers or things and verify that it's true, unlike ChatGPT or other general large language models out there. I'll just ask it a question. They have some examples up there. You could ask it to write a prior auth letter, write exam questions. I'm going to write something very specific. So I'm going to say I am an ER doc with a patient with hypertension and no other medical conditions. They are on, let's say, 5 milligrams of amlodipine, and that autocorrect did not work. Let's see. And they have a blood pressure of 190 over 110. And then I'm going to ask it, what else can I start them on? I can ask it that question, and you'll see that it is thinking. It's a clean app. ChatGPT, very easy to use, intuitive, not very clunky. I love using it. And this is the answer it gives us, right? It is sourcing that the American College of Cardiology and American Heart Association is recommending, in addition to a calcium channel blocker, a thiazide-type diuretic such as chlorothalidone or hydrochlorothiazide, an ACE or an ARB, and then you can scroll through there, and it's talking about everything, contraindications, other things you should be taking into account. And then, of course, my favorite part here, it's sourcing to the exact reference sources that it pulled out all these recommendations from. And then you can click on all of these things, and you can see it's not just one recommendation. It's numerous things in New England Journal of Medicine, JAMA, American College of Cardiology. So it's pulling from all of these very reliable sources. The other thing I've liked is a lot of times patients will ask me questions about, is this going to interact with my medication, or I want to know about what you're prescribing me. And a lot of times it's not the medical knowledge I'm using it for, but it's finding those sources and then sharing those sources with them to give them that extra degree of confidence in that, hey, this is what this recommendation is rooted in, which patients have a right to. This is just something that for a lot of us that are AI naive, or a lot of these AI tools seem not relevant to us, this is one that is very relevant to any practicing clinician to at least play around with, because all of these tools, I imagine a lot of them are already being integrated into EHRs or will be very soon. The more we play with it, the more we're comfortable with it, the more we can see the flaws and ask questions about it, the better. Just another quick video I wanted to make, and once again, if you have a piece of software or app or anything else you want me to look into or review, I'm happy to do so. I'm a total tech nerd for all of these things, and I love playing around with them, and this is one of them. Thank you.